Today we will be doing a bed bath on Mr. Smith. I have already knocked on the door, I've introduced myself, I've explained what we are going to do. So now I'm going to identify my patient. Can you tell me your name and date of birth? And I'm looking at his armband while he tells me. I'm also checking against my order to make sure I have an order for any procedure I'm doing. Next, I will provide for privacy by pulling the curtain. And wash my hands. And we'll lift the bed up to a comfortable working height. Okay. I have all of the supplies I will need right here. We have bath wipes. I have a clean washcloth with just clear water here. We have 2 towels, a bath blanket, and an extra clean gown. I also have deodorant and lotion for after the bath. I'm going to go ahead and put clean gloves on. And drop the side rail. Making sure not to leave my patient's bedside while the side rail is down. With a clean bath blanket, I will drape this over my patient. And have them go ahead and hold the top of it so I can remove the blankets underneath. Remove these all the way to the foot of the bed. I will also remove my patient's gown. You can put this directly into a laundry bin, or if you're planning on changing the sheets after, you can just tuck it right there. All right. We'll start with the face with a clean washcloth and just plain clear water. Starting at the inner canthus and work your way out. And then pick a new place on the washcloth to do the other eye, in to out. And clean the rest of the face, forehead, behind the ears, and under the neck. And then we will move on to our bath sheets. With these wipes, you want to make sure you ask your patient if they have any allergies to chlorhexidine, if that's what you're using. And we will start with the arms. Putting a clean blanket, bath towel, underneath our patient. Start with the arm furthest away from you. Make sure you're protecting your patient's joints as you're lifting up on their arms. And we'll go ahead and start with the hand. And then clean up the arm in long strokes, avoiding any IV sites. And go ahead and clean under that armpit. Grab another clean one, and we can move this towel to our other arm. long strokes upward, leaving the armpit for last because you don't want to clean a dirty area and then go back to a clean one. And that'll go in our trash. With another clean cloth, we'll do the chest, exposing it just briefly as we need to. If this is a female patient and they have larger breasts, make sure to lift them with the back of your hand so that you can clean under in the folds. And throw that one away. We'll get a new wipe for the abdomen. And to maintain our patient's privacy, especially for a female, you can drape that blanket right over the bath towel. And we'll clean the abdomen. Next, we will move on to the legs, starting with the one furthest from me. You may want to walk around to the other side of the bed to do this if it's hard for you to reach over. If you're going to do that, make sure you lift up this side rail before you walk over. Keep our patient safe. Go ahead and lift above the knee. And using a fresh wipe, we'll go up the legs in long strokes. Make sure not to massage the calves. And then end at the foot. You shouldn't need to dry your patient with these wipes, but if they look particularly wet, especially between the toes, you want to make sure that that stays dry. And then we will move to the other leg. Starting again at the ankle, moving up in long strokes. And ending with the foot. If your patient is male, now would be a good time to clean the penis. If they are uncircumcised, make sure to pull back on the foreskin and clean under there in circular motions and replace the foreskin when you're finished. If your patient is female, you can go ahead and turn them to their side at this point. We'll throw that one away. This blanket. Go ahead and have them lift their knee and use this arm to guide them over to their side. You can hold on for stability. A clean wipe, we'll go ahead and do the back. And the outside of the buttocks, throw that away. At this point, I'm going to get clean gloves for the perineal area. and you want to clean from front to back using separate parts of the wipe. And then we can dry our patient off if they need to be. If your patient would like lotion, now is a good time to put that on. We'll remove these dirty gloves, throw those in the trash, and clean our hands. And ask our patient if they would like deodorant. Straighten out a bit. And we'll get a fresh gown. Now is also a good time to clean the linens, to switch those out, especially if the bed is soiled or wet. And we can pull this bath blanket straight down, keeping our patient covered. And remove our dirty linens and replace with clean linens. Make sure your patient is comfortable in bed. Put that side rail back up and lower the bed to its lowest position. And I will go ahead and wash my hands and document.